Okay, so lastly, we're going to talk about the force field analysis when it comes to this case study and based on postpartum hemorrhage. So when talking about force field analysis, we gotta see what are the forces there are for the change and the forces there are against the change. So some of the forces there are for the change to be able to decrease postpartum hemorrhage by using accurate blood loss measurements is a good thing that a good force towards it is the idea that it's the leading cause of mortality death. So implementing this quality improvement plan will then help reduce deaths when it comes to postpartum hemorrhage. A second force with it that is good that supports it is by having a more accurate method of measuring blood loss, we get to implement or we have an early way of detecting that a patient is hemorrhaging or bleeding out, and therefore that we could have faster and quicker treatments for it, faster blood transfusions, faster interventions, because we actually have um, a more accurate way of measurement. Another force towards this implementation is that this method is the only method used that is objective method. This is the only one because everything else is objective visually. That's only visual estimation or visual estimation. Blood loss is based on what the person thinks the measure. But however, when we actually use the drapes and the scales to weigh things, we actually get a number and we actually know how much the patient is bleeding. And the other side, what are things that are against this change? So, like mentioned before, we're gonna need more scales. We're gonna need to constantly use drapes, more pads to be constantly checking patients. Therefore, more material that is more cost for the hospital. So that's something against the implementation. Also, like mentioned earlier, staffing and doctors being resistant to the change. Sometimes they're so used to, or they're more old school and they got used to that form, and sometimes staff is not willing to change their methods for new. So resistance would be something against this change. And then the third thing is more time consuming for the providers. For example, now the doctors doesn't just visualize it. Now they actually have to look at the put the drape under it before they start. Actually calculate how much amniotic fluid was and subtract it for the actual blood lost. And for nurses, now they have to actually weigh the pads, which instead of just a visual like, oh, okay, I think she's minimal bleeding, they actually have to weigh it and get and add to the total to have a total blood loss.